Welcome to the JEMS Report, brought to you by Clarion Events, Fire and Rescue Group, and the Journal of Emergency Medical Services. My name is Ted Lee, and I'm the editor-in-chief of JEMS Magazine, along with Jeff Frankel, our managing editor. The JEMS Report brings industry leaders and subject matter experts in all areas of pre-hospital medicine. Today, we have a very special guest with us, Dr. Jeff Jarvis, who sits as the chair on the EMS committee of the American College of Emergency Physicians. Thank you very much for coming today, sir.
Thank you for having me, Ted.
So why don't you introduce yourself to the audience and give us a little bit of your background in emergency medicine and EMS.
Absolutely. So as Ted said, my name is Jeff Jarvis. Probably first and foremost, I'm a paramedic. I've been a paramedic since 1988. About 11 years after I graduated from paramedic school, I decided I wanted to be an EMS medical director, so I went to medical school and did residency. That means I'm also an emergency and EMS physician, and right now I have the honor of serving the citizens and the men and women of EMS in the Fort Worth area. So Fort Worth and 13 surrounding communities. I'm the chief medical officer here for the MyEMSA system. What you may have heard of is MedStar.
Great. Well, thank you for your service and your continued service for us. So the topic of this week, of course, is the 50th anniversary of EMS Week. And we've had a couple guests on already that have come from the American College of Emergency Physicians. And we're looking for, the background. Why is the college interested with EMS Week and affiliated with EMS Week? And maybe you could shine a little light on the background of EMS Strong for us.
Yeah, absolutely. So as you know, EMS Week has been around, as you said, it's the 50th anniversary. President Ford actually signed a proclamation saying we're going to celebrate this week or use this week to celebrate EMS professionals in the EMS profession. He signed that in 1974. That turns out that is relatively soon after a landmark paper that really birthed our profession, the white paper. And it also coincides with the birth of EMS and the birth of emergency medicine. So emergency medicine and EMS really have a shared adolescence and shared childhood. We've grown up together. Emergency medicine has always been a part of emergency medical services, and ACEP, as it was founded, had always had strong support of EMS as part of its charter. So ACEP, the American College of Emergency Physicians, that's the national professional society that represents emergency physicians and all of the people who practice in EMS or in emergency medicine, has always had a role in celebrating EMS Week. So for 50 years, ACEP has been there helping organize, along with NAMT, the National Association of EMTs, helping celebrate our profession.
So through the week, it's, Sunday through Saturday, and we have various topics through that. So, let's break out, a few of the topics to discuss. Sunday being Health, Wellness, and Resiliency Day. This is a hot topic in EMS, very much so in the post-COVID world. Had a podcast the other day where we were talking a little bit about this, and I mentioned the old adage, and the gray in me shows up, the suck it up buttercup type mentality, where it was just charge forward without really paying attention. So why does this become a focus for us now?
Yeah, clearly. So I think hopefully all of us recognize that just because we've always done it that way doesn't mean that is the best way to continue doing things. So I think you seem to have a really effective way of hiding the gray hair. I'm working very hard on that same approach to suppressing it. You're right. A lot of the way we handled things was by pretending they didn't exist. And it turns out that approach has shortened the careers of many of our colleagues. A lot of our colleagues are no longer with us because of that approach. And I think we have started to recognize that is not good for our clinicians. It's not good for our partners. Ultimately, it's not good for our patients. So obviously, we can't serve our patients if we're not there to serve them, and we have to take care of ourselves first. I think one of our first and foremost missions in EMS along with the fire service, is making sure that everybody gets home safely at the end of their shift. So recognizing the stresses that face us aren't limited to fire or collisions or being shot at. The stresses of the job build up and take their toll. The longer you've been doing this, the more that stress seems to affect you. So it's probably a really good thing that we're recognizing that and trying to build systems that help take care of all of us a little bit better.
Yeah. And another hot topic that we hear quite a bit about is recruitment and retention. And I think the mental health and wellness and the overall wellness and crew safety plays a large role in that retention of providers, keeping people who are interested. And, I never faulted anybody that said, I wanted to go to med school, or I want to go be a nurse, or I want to go to respiratory therapy. If they found another passion, within healthcare that they wanted to do, well, then, celebrate them. That's great. You found another passion. Right. Awesome. Go. But for the ones that burned out or rusted out and just was, I'm done, I just can't do this anymore. We lost too many really good providers for that. And, nowadays it's even harder to get people to come into the profession. So we have to very much take a different look at the way we've been doing things. We can't, to your point, we can't keep doing the same thing over and over again and expect that it's going to fix it. So,
Ted, nothing really brought that. I think we had been slowly but surely recognizing that and beginning to recognize this is more of a problem. But man, the pandemic just pardon the phrase, but beat the crap out of us. Yeah. It really was. It was a horrible time to be in EMS, to be in medicine in general, but particularly to be in EMS. It was just hard. And in a lot of places that didn't have really solid infrastructure around wellness and around resilience, we saw people just saying, look, for my own health, I'm not going to do it anymore. Yeah. And we're going to be paying the price for our lack of preparedness. And I don't mean, MAT, PPE and that type of thing. We'll be paying for that too. But the lack of preparedness of taking care of each other for a really long time. Yeah. And I'll tell you, as a segue to one of the other days of EMS, Monday, we're focused on education. And the impact of saying we're no longer going to put students into harm's way during the pandemic, we're going to be paying for that for easily generations of EMS providers, as well as just the rest of medicine.
Yeah, it definitely changed. And, we talk about the pandemic quite a bit. And, for a lot of conversations, I mentioned that, the gloves came off, things that we were told we couldn't do before, we were forced to do. And now they're like, well, you can't do that. And we're like, we've been doing this, we had to do this during this time. And the comment I always make is, you can't stuff the genie back in the bottle. You've already let them out. We've already seen a different way of EMS providers interacting with the public, one Absolutely. That could be safer, could be more cost effective, and could just be better overall. So it opened up a lot of eyes to the capabilities of emergency medical services. And of course, we're always the one to say yes, and you're like, hey, we have a problem. Can you help us? Yes. All right. How are you going to do it? Have no idea how we're going to do it, but we'll figure it out, but we can help. And I think that's opened up, quite a bit. And I'm hoping that, the 50th anniversary of this, and then being post-pandemic, a lot of the public starts to realize that emergency medical services probably has changed from what people used to understand it. And I think a lot of people inside the service, we have a lot of opportunities that, we didn't really understand necessarily, and we're going to have to do things differently than what we did in the past. Right, wrong, and different. We had to do some things that might not have been optimal coming out of the pandemic, but we definitely learned some lessons from that for sure.
Absolutely. And I'll tell you what, I think you talked about the recognition of the system, and I don't mean a slap you on your back and in town saying, hey, you're doing a great job, but policymakers realize this is a massive untapped resource. The one thing we are really, really good at is being incredibly flexible, changing everything we do on a dime. And when you compared how emergency services dealt with the pandemic and compare it to a lot of the other institutions in American life, they broke and we didn't. We bent a little bit and then we figured out what we need to do. We adjusted course. We tried some things. Some of those things didn't work. And we just kept trying different things until we found what did work. That's what we do every day. And that's not, as it turns out, what the rest of the country does.
Right.
So I think our policymakers have really recognized that. And I hope they will, and I think EMS Week is a great opportunity to stress this. We are here to serve, but we need your support also.
Right.
And that's, I think, one of the real values of EMS Week is getting policymakers to understand what we do, understand the tools that we bring to bear and how indispensable we are. And if we truly are indispensable, we need their support to make sure that we're here next year too.
Right. So, and that goes into, Friday being recognition day, but, the entire week, of course. So Tuesday's safety day, of course, emergency medical services are all about, safety and trying to make it, we were created, off of national highway traffic safety and car crashes in the United States. That was a lot of our founding. So how does Tuesday?
Almost like a neglected disease of modern society, perhaps.
Right. And the fact that, unfortunately, in the United States, people weren't being cared, quite as quickly or quite as effectively as, soldiers were overseas, during Korea and Vietnam. So it was definitely an eye-opening experience. And I think, again, going back to the pandemic, that was an eye-opening experience for a lot of people, looking at the United States and, the robust healthcare system that we had, and then having to adjust to something so massive, across the United States, watching, different systems crumble or shine, based on, just the resiliency of the group that was running it. So it's quite interesting for sure. And we'll be looking at that, for decades on case studies for sure.
Yeah, absolutely.
So the other days, of course, Tuesday is a safety day. Wednesday is EMS for Children's Day. Thursday is Save a Life. And, a couple of them seem to overlap, education and save a life, or education and, well, education seems to be the theme across the board, educating the population for safety and preparedness, bicycle safety, car seat safety, emergency preparedness, first aid. Stop the Bleed, of course, is a very popular program. Hands-only CPR too. So, what is your area?
A lot more citizen. Well, we're doing the same thing, obviously. Citizen CPR. So early recognition, early access to AEDs, hands-only CPR, telephone CPR. Stop the Bleed, get tourniquets out there, and obviously we live in times where there are a lot of opioids out there. So making naloxone more readily available to the public. And then within the medical community, making things like buprenorphine more available to people who are suffering from substance abuse disorder. So hopefully we won't have to use the Narcan.
Right. Well, it's all about getting, out in the community. And it's kind of funny too. EMS is a service industry. We're out in the public, and EMS Week is recognizing that. But at the same time, you see services being out in the community even more, working even harder to engage with their community for these type of programs. Hands-only CPR has been, a wonderful thing. When I was I used to run an education program that was part of our community service, where we would go out and teach hands-only CPR, AEDU, Stop the Bleed to local high schools and middle schools, just to get the word out and, have people more comfortable with recognition of emergencies, because, that's critical now as well. With the resources that we have. So
So one of the things that we do, we have a pretty robust mobile integrated healthcare team, MIH team here in Fort Worth. And one of the things that we do as far as community education when we're working with our clients, not necessarily through 911, we're working on educating them about how to take better care of themselves, with whether it's their blood pressure or diabetes, medication compliance, and broader things, just risk reduction things like how do you make sure that your house is safe? If you are elderly, if you're at risk for falling, what can we do to modify those things in your house that make it less likely that you will need our 911 services? And you can, hopefully have a more fulfilling life.
Yeah, that's something that, we're starting to see more and more with the agencies. And of course, as, a large portion of EMS services are either closely working with fire or have been absorbed into fire departments. Fire has always done an excellent job of,
Yeah.
Recognition and, protection, and through compliance and regulations and making sure that, there are less fires. They have shown us kind of the way that this, interaction with the public and being out there in a preventative state, really, is tenfold. It's a force multiplier with
Yeah.
your actions if you're able to get out there. So, seeing groups like yours and, these mobile integrated healthcare providers, as these programs are expanding and they're spending more time in people's homes, that education just becomes more and more important.
Yeah, agree completely.
So, as we're getting ready to wrap up for this segment, what is, you've been in the profession for quite a while. What does EMS Week mean for you? You've been a paramedic and now emergency physician, and you've seen it since 1988. You've seen the progression through this. What do you take away from this? How has it impacted you?
So I think the wonderful thing about EMS Week is it gives me a week to reflect back on my profession. So EMS it's given me a purpose in life. I wanted to be an electrical engineer, and I realized that, as it turns out, A, that's not all that exciting, and B, you got to be way better at math than I am. I fell in love with EMS. I knew my senior year in high school, and I was a volunteer firefighter. I knew what I wanted to do with my life. It's truly has given me a purpose. So I'm very thankful for what EMS has given to me. And EMS Week is a great way for us to focus our attention back on what it's given to so many people, not just people like me, people who have benefited from being in the profession, but most importantly, the people we're here to serve, our patients. There are tons and tons of people out there that are living healthier lives because we've been there to help them.
And that's a great message too. It's always about service, and that's, people get into it and you're like, oh, I want to drive fast and I want flashy lights, but it's always about, service.
Right.
I want to help somebody. We don't want anything bad to happen, but if something happens, I want to be there to help them out. And
Exactly.
that's usually the case of that. So, well, thank you very much for spending time with me
Of
today,
course.
and thank you very much for your service. And I hope you have a happy EMS week and be safe out there.
Thank you, Ted. And thank you for everybody who is involved with EMS. Thank you for taking care of your communities, and thank you for serving your profession. Have a good one, man.